Hello everyone, welcome to my channel Ravi Static Physio. So in the series of pharmacology, we are moving further and take another topic in cardiopulmonary pharmacology. So second is diuretics. So I have completed the congestive heart failure. So we are taking diuretics, which is water pills, to excrete out the excessive sodium material via the excretory system with in the help of kidney. So what is when we have to use diuretics tablet? If the excessive sodium are accumulated our kidney or in our nephron, so we have some like symptoms are like pain or abdominal pain, kidneys pain, and have to be kidney stone. So on that time we have to take water pills or diuretic to break down the sodium of inside our kidney or nephron to excrete out via excretory organ. So the introduction, the medication that help kidneys remove excess sodium and water from the body through increased urination. So it helps to increase urination to excrete out the sodium material in our body, primarily used to treat increased blood pressure in congestive heart failure and edema and swelling if the patient is suffering from high blood pressure. So the diuretics are decrease the heart pressure in have patients suffering from congestive heart failure. So that is also important for medicine for that, and also in edema to reduce the swelling and excrete out via kidneys the accumulated fluid over the limbs. So there are some types of diuretic tablets for treatment of different conditions. So first is loop diuretics. In loop diuretics, there is two tablets. First is furosemide and second is torsemide. So these medicine are used for treatment purpose to increase sodium in our kidney. And thiazide diuretics, it means they are increase the it means like increase the uh, water level in our body for the excrete out or break down the sodium level. So example is to medicine is hydrochlorothiazide. And next is to be potassium sparing diuretics. It means it break down the potassium and excrete out via excretory organ like kidney. So example is to be spironolactone and eplerenone. So these are two medicine to break down the potassium ion in our body kidneys and excrete via kidney and nephron. So what is the mechanism of action of diuretics? First, loop diuretics inhibit sodium and potassium and calcium transport in a loop of Henle and strong diuresis and decrease preload. It means they have to break down the sodium, potassium, and calcium in our loop of Henle transportation, and it act as a strongly diuresis. So also you have to break down and decrease the preload, and it will be easily excrete out via nephron and excretory organ. So what is the pharmacological action happen if you are taking diuretics? First is decreased blood volume. It means there is too much sodium and potassium and calcium are present in our body, so that the kidney is like too much have to pressure to like clean the blood into the kidney filtration. So it have to decrease the blood volume. Second is to be venous return decreases. It means the returning of the deoxygenated blood into the heart via different organ is to be decrease the pressure. And next is to be relief from pulmonary edema. It means there has to be edema of interstitial tissue in our lungs, so it will be decrease the pressure and decrease the pain over the pulmonary section. So next is to be where we have to use the diuretics, like which condition. First is congestive heart failure, acute pulmonary edema, and hypertension. So in hypertension, thiazide is the best medicine for the patient, and the congestive heart failure is a furosemide and torsemide is essential. And acute pulmonary edema, you have to take hydrochlorothiazide to decrease the pressure of the pulmonary or edema or relieve the pressure over there. So these are some medicine, these are some indication we have to take the diuretic tablets or water pill to break down the sodium potassium level in our kidney, filtrate the easily our blood, and decrease the blood venous return, decrease the blood volume, decrease the blood pressure, and smooth the muscle function of the blood vessel, and also relieve the pulmonary edema or pulmonary tension. Adverse effect: if you are long duration taking the diuretics, it cause hypokalemia. It means there is chance to deficiency of potassium in our body. And dehydration, it means repeatedly diuretic you have to use, so continuously excreting our the watery substance in our body or fluid in our body, so there is chance to be dehydration, dizziness. Ontotoxicity, it means increase the chance of toxicity in our body. Gout, it means the bony extra bony formation in our joints and our bony substance. Hypoglycemia, it means there is chance to increase the glucose level in our blood. Because why? Because it all the water is excrete out by kidney repeatedly, and there is no any kind of dilution or like too much water in present in our blood, so there is chance to glucose to accumulate and over the vessels in our different capillaries or veins and arteries. So the glucose level is to be high, and there is long term effect, it will be cause atherosclerosis in our blood. So there is the diuretic topic. You have to write in university examination for good marks. Thank you.